whenever you want.
Hello, everyone. Hola, bonsoir, buonasera, guten tag,
Hello.
and aloha. I'm Dr. Michelle DePhillips. I'm an assistant professor at the University of Delaware School of Nursing and a previous nurse fellow for the Global Consortium on Climate and Health Education at Columbia University Mailman School of Public Health in the United States. I welcome you with great pleasure to the second installment of our nursing course, Nursing on the Front Lines of the Climate Crisis, Strategies for Advocacy and Action. We're so pleased to be able to offer closed captioning for this course. For English captions, you can click on the CC button on the bottom of the Zoom window. For Spanish captions, please look to the link that will be posted in the chat. Today is session 1 in our 10-session series. Our topic is climate, health, and strategic advocacy. In a moment, we will be hearing from a nursing expert, Dr. Joe Bjorgaard. I'd like to express gratitude to our partners that have all had a huge role in development of this course. These are the objectives for the overall course. We are all here today to increase our knowledge and self-efficacy, to improve our communication, and to develop improved strategies for advocacy and action related to the climate crisis. A few logistical reminders. Individual attendance is automatically recorded for the live Zoom sessions, but attendance is not counted if you join with a colleague's link. So please be sure to join with your individual link. The session is being recorded. Following each session, attendees will be directed to the Alliance of Nurses for a Healthy Environment, or ANNE, learning platform. You can see the website listed on the bottom of the slide here, and you can also access it through these 2 QR codes. The black QR code on the left is for first-time users to create an account on the ANNE webpage. The blue QR code on the right is so that you can access the course directly once you have made an account. This is important if you would like to receive a certificate of participation or continuing education credits for the course. Step-by-step directions on how to access these recordings can also be found on our website, which we will link to in the chat. For certificates of participation, there is a final exam following completion of the course. It is a 20-question multiple choice or true-false exam. Participants must take the exam in one sitting using the same email that they registered for the course with. The exam link will be sent out on the final day of the course via email and WhatsApp, and it will remain open from Tuesday, December 2nd through Saturday, December 6th, 2025 at midnight Eastern Standard Time. The exam will not be reissued after Saturday, December 6th, 2025. Certificates of participation are awarded to participants who attend at least 7 out of the 10 live Zoom sessions or video recordings and pass the course final exam with a score of 70% or higher. Asynchronous views similarly after December 6, 2025 at midnight will not count towards this certificate. For those that watch the Zoom sessions live, you will receive a passcode by email to bypass the asynchronous video so you can obtain continuing education credit on that website. Nursing continuing education for US-based participants is provided through the Alliance of Nurses for Healthy Environments. In order to receive continuing education, there will be 1 CE available per webinar. You must attend the live webinar or view the asynchronous video and receive at least an 80% on the post-session evaluation. Participants do not need to participate in CE to get a certificate of participation. And now a little bit about our session logistics. Each session is going to be 60 minutes long and will end with a question and answer section. Please enter your questions for presenters in the Q&A section of Zoom and not in the chat. Session slide decks and resources will be available on the course website. And again, the video recordings will be available on the Annie Learning platform. These are all accessible on our website, and we will put some of the access links in the chat. So now we are really pleased and honored to welcome Dr. Jo Bjorgaard to talk about advocacy. Dr. Jo Bjorgaard is a nurse leader based in St. Paul, Minnesota, specializing in health innovation, leadership, and planetary health. She earned her Doctor of Nursing practice at the University of Minnesota and has extensive experience in planetary health, education, climate advocacy, and healthcare sustainability. Her professional roles include Operations Director of the Planetary Health North American Regional Hub, Instructor and Teaching Specialist at the University of Minnesota School of Nursing, Senior Climate and Health Manager at the Climate Advocacy Lab, Founder and Principal Consultant of Rise Climate and Health Collective, and Board Member and Committee Chair with the Health Professionals for a Healthy Climate. Jo advances planetary health by building cross-sector partnerships, strengthening leadership capacity, and promoting equitable, collaborative solutions to foster a healthy and resilient future for all communities and ecosystems. Thank you so much, Dr. Bjorgaard. We are very excited to hear about your presentation.
Hi, everyone. Thank you so much for that introduction. I'm just going to get set up sharing my screen here, and then we'll get started. Great. Can you see my screen okay? Okay, wonderful. Well, thank you. I'm really delighted to be tuning in here virtually with you all today. So I'm going to start by telling you a little bit about Climate Advocacy Lab. The lab primarily focuses on equipping the climate movement with the evidence-based insights, skills, and connections to build durable power and win equitable solutions. And we do so through a few different venues. So we support our members, and we have about 4,000 members. We conduct trainings for climate advocates and organizers. We host several trainings, workshops, and cohorts. We conduct original research. So we partner with individuals and organizations to carry out social change research. And we share what we're collectively learning via our members-only website, which is climateadvocacylab.org. And you'll receive a link to join the lab if you would like to. It is free, and there are a plethora of resources there. So this session will introduce you all to the critical role that we as nurses play in addressing the health impacts of climate change through advocacy and narrative leadership, really emphasizing the strategic use of storytelling as a tool for influencing climate policy and public awareness, situating this practice within the broader framework of evidence-based nursing and global health equity. We will be using Mentimeter throughout the presentation. It's really amazing to see on a map the diversity in this room. So I would ask you to either scan the QR code or sign in through the link, and you can start dropping pins wherever you are tuning in from today. And I'm going to pause here for just a moment so we can watch this populate. Great. Some pins popping up here across the US and Canada and South America. Great, we've got someone in Europe, East Asia. I think this is such a fun way to see where everyone is. And we can continue to sort of let it populate, and I can definitely screenshot this and share it out later as well. Wow, look at all the diversity here. This really highlights, I think, the reach and potential of nurses advocating for climate and health worldwide. So I'm going to carry on. Great. And this is the ecological planetary health model, which you're probably all familiar with now, being that you're participating in this series. And what I want to note here is that nurses can act at multiple levels and leverage strategies like adaptation, mitigation, and resilience. So let's talk about some of these levels of action. Nurses operate at every level of the health system and community, making them uniquely positioned to drive climate and health change. Our influence expands from direct patient care to shaping global policy. At the local and individual level, nurses educate patients and families about climate related health risks like heat illness, asthma, vector borne diseases. We also model sustainable behaviors in our workplaces and in our communities and demonstrate those actionable steps for healthy, low carbon living. Even these small individual actions can ripple outward when patients adopt healthier habits and share knowledge with others. At the organizational or institutional level, nurses lead sustainability initiatives within hospitals and clinics, such as reducing energy use, implementing waste reduction programs, or advocating for more climate conscious procurement policies. We participate in committees and boards or councils to integrate climate considerations into our clinical protocols or our institutional policies. And I think this organizational advocacy really multiplies impact because practices implemented in one institution then can influence standards and inspire other facilities. At the national or policy level, nurses engage with professional associations, unions, and national health organizations to shape policy guidelines and legislation that address climate and health. And we can participate in public campaigns, provide expert testimony, or help draft position statements for lawmakers. We have a lot of credibility as frontline health professionals, and that gives our advocacy weight and public legitimacy. At the global level, nurses collaborate with organizations and entities like the World Health Organization, International Council of Nurses, the United Nations, and the Planetary Health Alliance, or other global coalitions to influence international health policy, global climate health reports, and advocacy campaigns. We contribute in many ways, including data, case studies, and storytelling to amplify and communicate the human health impacts of climate change across international forums. And this level of advocacy really allows nurses to shape norms, policies, and funding opportunities worldwide, which extends our influence far beyond the bedside and beyond local communities. So I hope this will help you to see how nurses' influence is not confined to bedside care, and every level matters. What you do locally can inform policies nationally and globally. So in one word, I would love to hear what advocacy means to you, what climate advocacy means to you. And we'll pause here for just a moment. See healing, support, hope, future, privilege, caring, voice, justice, rest. These are really wonderful words, and that's where our advocacy is rooted. So now we'll discuss some of the fundamentals of advocacy. First, I want to define some of the key concepts. Often these words, organizing, mobilizing, and advocacy, are used in tandem because these are strategies that reinforce one another and work very well when used together. So first is organizing. Organizing is the process of building sustained relationships, leadership, and collective power within a community or a constituency to create long-term systemic changes. It focuses on developing leaders and shifting power rather than just winning individual policy battles. So, an example of organizing is healthcare workers in a city form a coalition to push hospitals to commit to net zero emissions. They build relationships, train new leaders, and create a sustained campaign to pressure hospital systems over several years. Next is mobilizing, and this is where we're turning people out for action. It's all about getting the most people together to take action. Usually, this results in large numbers of people at key moments. And while it builds momentum, it doesn't necessarily build that long-term leadership or infrastructure like organizing does. Mobilizing is very important and essential for demonstrating power, but it really needs to be connected to the deeper organizing to be effective long term. And an example of mobilizing is a healthcare advocacy group organizes a rally and petition to protest a new fossil fuel power plant near a hospital, highlighting the health risks of air pollution. Thousands sign and march, which pressures local leaders, but without deeper organizing, the energy fades after the event. So many of the people who attend an event like this don't continue on in their advocacy efforts. And lastly, of these key concepts, we have advocacy, which is the act of speaking up and taking action to create change by influencing people or institutions with power, whether that's policymakers, hospital leaders, community boards, professional associations, or the public. Advocacy can look like sharing stories. It can look like meeting with leaders, raising awareness through campaigns, or pushing for new policies or practices. And it's often most powerful when connected to organizing and mobilizing, of course. So, an example of advocacy is a coalition of doctors, nurses, and climate advocates pushing state legislators to pass a bill requiring hospitals to track and reduce their carbon footprint. They provide expert testimony, policy recommendations, and meet with those lawmakers to gain support. So, to be effective, these strategies should reinforce one another. Organizing builds power over time, which then fuels mobilizing to create that visible pressure. And that strengthens advocacy efforts to win policy and institutional changes. And if there are two things you take away from this, I hope you can take away a little bit about power. So, power is not a person, it's a thing. It can be measured by the extent to which a group can use its influence to get advocates to take action. There are two main types of power. There is power with, which sometimes we can create the change we need just by organizing our resources with others and creating power together. There's also power over. This is when others control the decisions or resources that we need to create change. And in those cases, we have to build power with others to push for the resources and decisions that serve our needs. Power brings the idea of interconnectedness, which is how relationships work with targets, with our stakeholders, and within movements themselves to affect progress. It transforms our individual capabilities into this collective impact. So, if you had asked me about 15 years ago when I became a nurse if I thought nurses were powerful, I probably would have said no. But today, I feel very strongly that nurses are powerful. We are the largest cadre of health professionals across the globe. We're trusted by the public, and we care for health at all levels from individual to planetary. So think back to the previous slide and recall that organizing is how we build that durable and long-term power to make change. And I urge you to consider how you can organize with other nurses to build power in your own advocacy efforts. So we'll shift to talking about some strategies. We've covered the fundamentals of advocacy, and now we'll move on to some key strategies for nursing advocacy. These are some of the strategies that I feel are very applicable across contexts and across settings. The first is evidence-based advocacy. So this is actions are informed by evidence. This should be familiar to us all as nurses. Next is coalition building and partnerships. This is collaborating with others for greater impact. We then have media and communications. This is amplifying messages and reaching more people. And lastly, storytelling and narrative building. This is our personal and professional experiences being used to engage others and build support. So think of evidence-based advocacy as applying the same rigor that we use in nursing practice to our advocacy work. We as nurses don't act on hunches, we act on data, experience, and evaluation. So for climate and health, this is especially critical. Policymakers and the public are often inundated with competing messages. So evidence helps nurses to really cut through the noise and bring trusted, credible information to the table and not spend time just throwing things at the wall to see what sticks, because frankly, we don't have time for that. The combination of data or evidence and story is particularly powerful. Data shows the scale of the problem, and stories make it real and make it urgent. So an example of evidence-based advocacy is presenting hospital data on respiratory illnesses linked to poor air quality and bringing that to local policymakers. Next, we'll talk about coalition building and partnerships. This is diverse groups like nurses, health professionals, community leaders, policymakers, and even sometimes very unexpected allies who unite their resources, their knowledge, and influence to achieve change that no single person or single organization or group could accomplish alone. Coalitions work because they build collective power, and alone, even the most passionate nurse could be dismissed, but together, coalitions really command attention. Coalitions also mean shared workload, so you don't have to carry the advocacy effort on your own. Others may bring the science, the policy expertise, or the political leverage, while we as nurses bring the frontline health perspective. For climate and health, coalitions are especially important because the crisis is intersectional. It cuts across health, energy, housing, agriculture, justice, really all sectors and all living things. So we need diverse voices at the table, and coalitions are one way to bring diverse voices. Next, we'll talk about media and communications in advocacy. This is about using traditional and digital platforms like newspapers, radio, social media, blogs, podcasts, and public speaking to raise awareness. This shapes public opinion and influences policy. So it's really how we move our message from the bedside to that broader public arena. Nurses are trusted messengers. We are regularly ranked as the most trusted profession around the globe. So when nurses speak, people listen. Media expands our reach. One op-ed, one interview, one post can influence thousands or even millions, far beyond what that one-to-one conversation can achieve. So some examples here are running a social media campaign highlighting hospital sustainability efforts, or speaking at a community forum about disaster preparedness and health. And the Climate Advocacy Lab has done a ton of great research on what messages actually work when we're communicating about climate change. So using the key principles here on this slide will make messages as effective as possible. So you want to lead with shared values. So identify the values within your constituency or the audience that you would like to reach, and lead by discussing or presenting those shared values. Keep it simple and solutions oriented. So don't get bogged down with jargon or too much data. Keep the message fairly simple and always offer a solution. This will elicit that self-efficacy and allow your listeners or your audience to feel like change is possible. You want to match the trusted messenger. So try to understand who your audience or your constituency trusts, and then bring the message to them through that trusted messenger. Make it personal. So that can be done by tying in global impacts that are personal to that specific community. And then lastly, message framing. So framing climate as a health issue works, and it engages audiences and people across political lines. So we've talked about several advocacy strategies like influencing decision makers, and building that grassroots power. And we're now going to shift over to talking more about storytelling and narrative building. This really helps to connect the facts to people's values and experiences and makes our advocacy more relatable, more memorable, and more persuasive. So, narrative capacity is a movement's ability to articulate their own voice and vision, have it heard and absorbed by the public, and have it responded to by decision makers. And narrative is the pattern that emerges from a system of stories. And this sometimes emerges through media, across politics, and across culture. Storytelling and narrative building help us to understand these complex issues, make sense of the world, and build a case for action beyond data, beyond facts, and beyond figures. And I'll share a little bit about why storytelling and narrative building work. Neuroscience research actually shows that hearing a vivid story about an experience stimulates the same region in our brains as having that actual experience. So it really takes us there into someone else's experience. And our brains are hardwired to seek out stories and make connections through them to our current environment. So stories really, really work with the human brain. And a little bit more on why storytelling works and why it matters, especially in climate and health advocacy. So it connects climate, health, and equity. Stories reframe climate change as health and justice issues that affect our patients, affect communities, and affect healthcare systems. It creates a shared sense of urgency. These personal stories make impacts real. So one example is asthma from air pollution or heat stress in workers, hospitals under strain from extreme weather. It makes these impacts real. It also bridges silos and builds buy-in. So narratives unite clinicians, administrators, and policymakers by linking climate action to the mission of equitable and quality care. And it makes solutions tangible. So it shifts focus from problems to possibilities, like sustainability initiatives, resilience planning, and climate smart care. A well-crafted narrative brings stakeholders together and really shows how climate action aligns with health. So, stories can be integrated into advocacy in many ways. You might adapt your story or the format of your story depending on your audience and your advocacy goals. So, for example, a community panel may allow for a full, longer, engaging story, while a pitch to your organization requires a shorter, concise, high impact version with a very clear call to action. Some of the ways that you might use your story and integrate that into your advocacy efforts are through speaking and presentations. You might bring your story and integrate it into a panel discussion, into a conference presentation, or community events. We can share patient and community experiences, and that makes climate health impacts tangible. You might use your story in writing and publishing through op-eds, blogs, or journal articles. This will raise awareness, shape public discourse, and reach diverse audiences. You could use your story through media and digital outreach, like radio, podcasts, or social media. This again expands reach and amplifies nursing voices globally and locally. It's very effective to use our stories in policy and organizational advocacy. So that's things like public testimony, pitches to funders, and leadership presentations. Here we want to use those concise stories to influence those decisions that we would like to drive action forward. And then you might use your story in creative and collaborative storytelling through artistic partnerships, visual storytelling, or multimedia campaigns. This makes our narratives very vivid, engaging, and memorable for our audiences. So we've just looked at why storytelling is such a powerful advocacy tool. To bring this to life, I want to share an example from my own experience. This case study shows how a personal story can connect climate, health, and equity in a way that data alone cannot. To give some context on the story that I'm going to share, I've included some images here. So the two photos on the left show me leading a local ride as part of Ride for Their Lives, which is a global campaign bringing together healthcare professionals. And this really highlights actions needed to protect the planet for our patients and future generations. So during this bicycle ride, I shared my personal climate story to engage participants and also engage the public in illustrating why urgent action is needed. We actually had several news sources there, and so I was able to integrate my climate story into my advocacy message for the media as well. And the photo on the right shows me in my homeland of Victoria, British Columbia, Canada, which is where I feel most connected to the planet. Over the years, I've learned how to integrate my climate story strategically into much of my advocacy work. I've shared it in community with other nurses, like I will do today, to really connect and exchange experiences. I've used it to engage the public during advocacy events like the bicycle ride that I mentioned. I've also brought it to policy briefings, especially on clean transportation. And I've adapted it into concise pitches to health systems to request investment in sustainability initiatives. So today I'm going to share my climate story with you as an example of how you might begin to use your own story for advocacy. And after that, I'll share a shortened version to demonstrate how the same story can be adapted into a concise, impactful pitch for leadership or decision makers. Now, quick sip of water. All right. I grew up in Victoria, BC, Canada, a place that felt absolutely magical to me as a child, and it still does today. I would stand on the rocks by the ocean, feeling the cold mist on my face and listening to the mesmerizing sound of the waves. I felt safe. I felt connected to the water, to the sky, the trees, and the world all around me. And that connection shaped how I understand and think about caring for people and the environment alike. I became a nurse, and over the past 15 years, I've worked in the ICU, the pediatric emergency department, and procedural areas like the PACU and interventional radiology. At the bedside, I saw how fragile life can be and just how deeply environmental conditions can affect human health. I saw children struggling to breathe because of wildfire smoke, elderly patients suffering from heat stress, and families overwhelmed by preventable conditions that were rooted in the changing climate. One summer, in particular, brought it all into focus. The air quality was so poor that my own small children's baseball games and summer activities were canceled. My kids had to stay inside on what should be a beautiful day playing outside because the air quality index was unhealthy for all people. During that time, I was working in the pediatric emergency department. The unit was frequently full to capacity, overflowing with kids experiencing respiratory distress and asthma attacks. We had children sitting in recliners behind the nurse's station because there simply were not enough rooms. Imagine being a child trapped inside on a hot summer day and then ending up in a hospital because of the air you breathe. I couldn't separate my professional life from my personal one anymore. Caring about the planet and connecting with nature couldn't just be a hobby or a part of my personal life. It had to be woven into every part of my life, and especially my role as a nurse. As a parent of four children, ages 15 months to 13 years, children that I love with every single bone in my body, I think about the world that I want them to grow up in. I want them to stand on the rocks and feel the ocean spray, explore the forests, and connect with the earth in the ways that shaped me. I want them to breathe clean air, to enjoy summer days outside, and I want this for every child, every person, every being. This is what has pushed me into systems level work, advocating for planetary health, sometimes by helping organizations adopt more sustainable practices, sometimes by educating nurses and other health professionals about climate and health, and taking on roles that let me integrate climate advocacy into my work as a nurse. But it all started with that connection to the natural world, that first sense of awe and safety in Victoria, and the urgency I felt watching children struggle in the emergency department. My story is one of seeing, feeling, and acting. It's about the power of noticing the world, noticing the impacts on human health, and realizing that we, as nurses, as parents, as citizens, can't separate caring for people from caring for the planet because they are one and the same. So see the connections, tell the story, act. The health of people and the planet depends on it. So I'm going to pause now and ask, now that you've heard my story, you to take a moment to reflect on your own experiences. Think about moments in your work, your life, or your community that have shaped your perspective on climate and health. And over the next couple of minutes, submit a word, a phrase, or a short sentence that tells just a fragment of your story. Don't overthink it, just the first thing that comes to mind. So take a moment to reflect on the experiences that could form the foundation of your climate story. And we'll just pause for a couple of minutes. It's the impact of nature on mental health, developing asthma, malaria. The passage of Hurricane Dorian in 2019 challenged me to think about justice and embodiment, military service, and becoming a conscientious objector, wildfire smoke, and having young children. So you can see that there are many shared experiences here that have shaped our perspectives on climate and health as a community of nurses. So feel free to keep dropping those in, and I'll continue on. So as I shared, I've adapted my story for many specific advocacy related goals. These photos show me partnering with health professionals to guide them through how to identify and develop their own climate stories to be used in their advocacy efforts. So now I'm going to share how I've adapted my story to make a very concise and short story-based pitch to my previous health system to implement more sustainable practices. I've been caring for patients in the ICU and pediatric ED for over a decade. And one thing is clear, climate change is already affecting their health. Last summer, during extreme air pollution, our pediatric ED was over capacity with children experiencing asthma and respiratory distress, some sitting in recliners behind nurses' stations because we had no available rooms. This isn't an isolated incident. Climate-related health impacts are rising, and hospitals themselves contribute to greenhouse gas emissions. As nurses, I see both the human toll and the opportunity for systemic intervention. I'm asking the health system to measure and track greenhouse gas emissions and to develop and implement
Can you unmute yourself, Joe, please?
yeah. I'll back up just a little bit because I think I was muted. Okay, great. So this is not an isolated incident. Climate-related health impacts are rising, and hospitals themselves contribute to greenhouse gas emissions. As nurses, we see both the human toll and the opportunity for systemic intervention. I'm asking the health system to measure and track its greenhouse gas emissions and to develop and implement a concrete emissions reduction plan. By doing so, we can protect patient health, improve outcomes, and demonstrate leadership in climate and health. I would be happy to partner with leadership and staff to implement these initiatives and measure their impact. And together, we can create a healthier environment for our patients and our community. So I hope this has provided some examples of how storytelling can be applied as a valuable advocacy strategy. And this shorter pitch that I gave my previous health system was actually very effective. We did end up partnering to develop the first greenhouse gas emissions measurement plan for this health system, and that resulted in reduced emissions. So I will ask you to think about a change that you want to see in your organization, your community, or beyond, that you could influence with your story and share a word or a brief sentence to describe that change. So just take a moment to share your thoughts. This will help you start connecting your own experiences to concrete advocacy goals. This one, oh, I was going to say, is this one just asking you to write it in? I like the writing with the typed words. That actually looks very cool. So behavior change, wildfire, more meadows for the pollinator pathways across New England, to improve the litter around campus, to create a tool to ensure climate impacts are considered with new applications, better air quality, to think different. Native plants in all gardens, and reduce hospital waste. Great. So these are very tangible asks that you can make using a story-based pitch. And feel free to keep sharing them. So I hope that some of you feel excited or at least a little bit curious about crafting your own climate story and using it in your advocacy work. Remember that your experiences, your observations, and your passion are very powerful tools. You can start small, reflect on what you've seen, what you've felt, and think about the action that you want to inspire. And your story can connect people, it can influence decision makers, and it can drive real change. That can be across all contexts and could be in your community, your workplace, or beyond. So seeing, feeling, and acting are the foundations for meaningful impact. I'm going to leave you with a few concrete actions to continue the process of crafting your climate story, which you've actually started with some of the prompts that we've worked through. And I'll also leave you with some suggestions on how to adapt it for different audiences and contexts. So you'll reflect on your experiences, identify the moments that matter most, and start shaping your climate story. Then think about how you might share it. You might share it in a community forum with leadership during a training or in advocacy settings. These small steps can lead to meaningful change, and your story is a very powerful tool to inspire action. So these I'm going to leave you with. You can work through these on your own after today's webinar. The first is how you can workshop your story if you would like to. You'll spend about 5 minutes per prompt. You write freely, be very descriptive and vivid, and follow the prompts that spark the most emotion. So the prompts are, where do you feel most connected to the planet or at one with nature? What personal or professional experience first made climate and health feel urgent to you? What motivates you to take action on climate issues? And what change do you hope to influence in your community, workplace, or sector? So that's one piece of homework you might choose to do. And next is how to build that into a more concise pitch. So a more concise advocacy pitch should be no more than about 1 to 2 minutes. You can start with the why. So share why the issue matters and what's at stake. Make it real. Use concrete examples, experiences, or images to ground the issue. You want to show the bigger picture. So show how it connects, your story connects to the wider challenge or opportunity. And then, of course, end with action. So this is where your pitch comes in. Offer a clear step, clear solutions, or a clear direction forward. And lastly, I will share a few storytelling resources that you'll be able to access through my slides as well. And thank you so much for this time spent together today. Feel free to connect with me if you have any questions or comments. I am happy to set up one-to-one meetings and discuss any of this information further. And with that, we'll open it up for questions.
Thank you so much, Dr. Bjorkard, for your powerful climate story, as well as your wealth of information about climate advocacy. This was a really powerful and informing session. We have a few questions in the Q&A, so I am going to do my very best to ask as many questions as we can with the time we have left. And so our first question here is, many of our participants are joining from diverse regions. How can nurses in low resource or climate vulnerable settings leverage coalitions to amplify their voice?
Yeah, that is such a wonderful question. So it would be identifying any organizations, individuals, or groups that have shared values or interests. You don't need to be working in the same context. You don't need to be one of the same profession. You really need to have the same sort of goal that you're working towards. And the beauty of coalitions is that you're bringing that diverse experience or different resources. Even if they are low resources, you're bringing people together then who are working towards shared goals.
Thank you so much. Another question that we had is, how do you ensure that marginalized or frontline communities are not just included, but actually lead in climate coalitions?
Thank you so much for that question. I think one of the, main questions that we should ask ourselves in any of our advocacy efforts or climate action efforts is, who does the action that we are trying to take or the initiative that we're working on impact most? And is that the most vulnerable people? And so long as we are focusing on our impact being an improvement for the most vulnerable people, that will then, by proxy, benefit everyone else because we really want to focus most on benefiting the most vulnerable people.
Thank you. So what are the most effective advocacy strategies for nurses when engaging policymakers or institutions on climate and health issues?
Yeah, that's a wonderful question. And I think I've shared a few of the strategies, so I'll do a little bit of a review. Power is in people. So power is relationships. We can build relationships, and the more nurses that come forward to discuss a specific issue or to advocate for a specific issue is more influential to policymakers. Framing is very important here, especially when it comes to climate change and health. So, bringing forward the tangible health impacts of climate change is really, really important. But what works even better than just discussing the health impacts of climate change is when we also incorporate the health benefits of solutions. So you might say to a group of policymakers, I would like you to take this action because climate change is causing negative health impacts related to climate change, say respiratory impacts. The solution I would like you to take is to transition to clean vehicles. And that actually is going to have the co-benefits of reducing air pollution and then reducing those negative health impacts like asthma and respiratory distress.
Thank you. Very, very helpful. A couple more questions here. If you could give one piece of advice to nursing students hoping to be effective in climate health advocacy, what would that be?
Oh, I love this question. I currently teach a group of senior level master's students. They're direct entry, so they're just about to become nurses and leave nursing school. And I talked to them about this in class last week. I think the number one piece of advice is to find your people. So find your people who have similar interests and similar goals. Doing advocacy work alone is very lonely. It can feel very taxing. It can feel sometimes like you're not getting anywhere or banging your head against a wall. But when you can do so in community, it just makes the work so much lighter and so much more enjoyable. So I think my number one recommendation is to find your people and then build your advocacy work with others.
Right. I think we have time for about two more questions. So there's a question here that says, what role do global nursing networks play in advancing climate advocacy? How can we connect across borders?
Yeah, to me, they have a massive role to play. We can see that nurses are being included more and more at the global table around climate conversations, like at COP. We're also contributing more and more to global reports on climate change. And I think partnerships are really being built across sectors. Nurses are also being included more and more at the United Nations, where we can really talk. Across, global contexts to build our international and global goals and policies. So I think that nursing organizations have a massive role to play. And even by partnering and coming together as these global nursing organizations, that shows solidarity and brings power.
Thank you. So we have a participant that asked about recommendations for regional organizations to get involved with. Do you have any recommendations on where our participants might be able to find some regional organizations, be it Africa, Asia, Caribbean? Where can they kind of go to start looking for this?
I would start with the Planetary Health Alliance. This is an absolutely fantastic global organization that has regional hubs. So that's a really great place to start. It's free. You can join a regional hub. They're all across the globe and find ways to get connected in with a community there. So that's one. And then look at nursing organizations, look at different academic institutions. Um, and then I'm sure the Global Consortium also has some resources to share. And if anyone would like specific regional recommendations, you can also feel free to reach out to me, and I'm happy to do my best to make connections where I can.
Another great kind of tangible question here is you've talked about narratives and how people can share their stories. Do you have any recommendations about where nurses might be able to share their experiences about climate change online, or through any specific platforms that might be helpful?
Yeah, absolutely. I've seen nurses share their story on LinkedIn and that be very effective. I've actually included that in some previous presentations where I've just screenshot different case studies of nurses sharing their stories through LinkedIn. So that's one very accessible option, I think. You can also share your story through podcasts, through talks, through blogs, through different trainings. Look for cohorts, look for communities that are getting together. You could share your story through your green team at your hospital, or ask if you can be featured in a newsletter or an insight. There are just a plethora of opportunities and ideas as far as story sharing goes.
Thank you so much. And I think we have time for one more question. So to piggyback on that kind of online resource related question, what is an action that an individual nurse, oh, apologies. What are the risks and pitfalls of using social media for advocacy? How can nurses navigate these?
I think the biggest risk and pitfall is, of course, the risk of misinformation, of the information that you're sharing being taken out of context or being taken and then reshared out of context. So that can get a little bit tricky and can be risky. What was the second half of the question?
It was just how can nurses navigate this?
Hmm. Yeah, that's a good question, and something that I think I will need to ruminate on a little bit more. I certainly have access to a lot of sort of digital resources and resource guides that I'm happy to share out, or you can access through Climate Advocacy Lab. But I think the biggest thing is understanding where you are sharing your information and whether it is a trusted place for you.
Thank you so much for answering all these wonderful questions that participants have had from around the globe. We really, really appreciate this wonderful presentation. I think I can speak for many in this group that we've really learned a lot from your talk today. So immense gratitude to you. And for those that are joining us from around the globe, we hope to see you next week for our session. Session 2 in the series will be presented by Dr. Barb Sattler and Dr. Gina Friel about the topic of just transition. Don't forget to join the course WhatsApp group for updates or any information. If you have any questions, that link should be in the chat. And I want to thank everyone again just for joining from all around the globe. We're here to learn about strategies for advocacy and action, and this is what is really joining us together. Thank you again, and goodbye to everyone. Adios, au revoir, auf Wiedersehen. I hope you all have a nice morning, evening, afternoon.
Thank you.
You all.
Gracias, adiós.
Hi, this is wonderful.
Everyone.
Thank you. Bye-bye.
Thank you very much.
Thank you.
Guten Abend. Good evening. Thank you.
Thank you very
Thank you
much.
very much.